Hi, welcome back to Everyday Behavior. So during this lesson, we're talking about how ABA therapy works best when it's part of a comprehensive behavioral intervention package. So this month, we're talking all about ABA therapy, and we've talked about commonly asked questions of ABA, the foundation of ABA, and kind of what to expect in ABA. But ABA itself works best when it's in conjunction with several other therapies. So like we talked about, ABA really addresses a lot of skills, including communication, daily living skills, play skills, and functional life skills, academic, pre-academic skills. And so ABA works best if we're also working with the child's speech therapist. So ABA is working on speech and language communication, but speech therapists also are addressing speech and language communication. And so when ABA is working in conjunction with speech, then they can both be working on the same sign language techniques, the same terminology, the same assistive technology, or the same verbal communication goals. And behavior occurs both in the ABA setting, but also in speech setting. And so that collaboration across therapies is very valuable. Also with occupational therapy, occupational therapists are also working on things like sensory concerns, daily living, fine motor skills as far as holding a pen or a pencil or a utensil. Both ABA and occupational therapy can address the sensory concerns associated with feeding and some behavioral concerns. And so when both your occupational therapist and your ABA therapist are working in conjunction or as part of a team, it can be very beneficial to help maximize the outcomes that your child is seeing. Your child may also be attending physical therapy or may need a physical therapy evaluation because sometimes kids don't play on the slide or they don't swing on the swings or they don't ride the tricycle, not just because it's a play skill deficit, but because it's difficult because there may be some underlying low muscle tone or gross motor skill deficits. And so ABA therapists, when they're seeing those deficits, may refer you to physical therapy, or your child may also already be attending physical therapy because of toe walking or another gross motor deficit. And so when those two therapies are working in conjunction, it leads to the best outcomes in those play skills and gross motor skills as well. Physical therapy can also work on some of the gross motor skills that are involved in getting dressed and undressed. And so when those therapists are working together, it really leads to the best outcomes. Also, it's really important if your ABA therapist is also working with the school or with teachers who are also working to address things like listener skills or instructional control, like sitting at the table, being on task, or even labeling. Both therapists might work on labeling things like colors, letters, numbers, shapes. So those are skills that are addressed in both settings. So if you have the opportunity to have collaboration across all of your child's therapists, that is important. But also know ABA is not the only therapy your child should be receiving. They should also be receiving speech, occupational, physical, or academic instruction in order for them to have a comprehensive care plan or comprehensive behavior intervention package. I hope that you found this information helpful. If you do find this information helpful, I encourage you to look for more information on our website at everydaybehaviors.com, or you can subscribe to any of our social media channels, including Facebook, Instagram, YouTube, or our podcast channel. Thank you so much and have a wonderful day.